My name is Eric Secemsky. I'm the Director of Vascular Intervention at Beth Israel Deaconess Medical Center in Boston, Massachusetts. I think the challenges that continue to plague the peripheral vascular space is there's a lot of dedicated clinicians that want to focus on this condition, but we all tend to concentrate in larger urban centers and larger hospital institutions, and that's not necessarily where the patients are. And I think that's been a big challenge, is that we have a lot of our patient populations in more remote, rural, underserved areas that don't have access to any quality of care or any vascular care in general. And so, I focus a lot on vascular deserts and the idea that we shouldn't dictate care because of where you live or who you are. It really should be given evenly throughout our whole population of PAD patients. And that's an area that needs to be improved on. And I really think team-based management, there's not one specialty that has enough person power to really tackle this disorder, that this is build a team, find dedicated clinicians from whatever specialties they might come from to really focus on the care for patients for wherever they are living across the globe. Education remains an critically important part of how we build our clinicians and then our patient engagement. In the U.S., we have poor funding for fellows to do vascular care outside of dedicated specialties like vascular surgery. So for other specialties like interventional radiology and interventional cardiology, the training isn't as fortified, the education is fragmented, the benchmarks and procedural competency are not instituted. And so I think that leads to a lower standard of care. And I think in education, I speak to the role of meetings like this, where there's networking, where there's abilities to connect people to good training opportunities, where there's on-site training, which are critically important. And then that leads to, the research side also, where as we become more educated and more dedicated to this field, we are more also committed to seeing the research forward, running clinical trials and trying to put a algorithmic approach so that we can standardize practices across, countries and as well as across, nations in the grand scheme of PVD care. I highlighted in my lecture that when we started in the peripheral vascular space, even questions like, should we be doing open surgery or endovascular management for CLTI, was based on one trial out of the UK, Basel 1, and we were stuck for 20 years without any more data. And I think that Charing Cross has been an impetus for not only pushing forward the idea that we need more prospective clinical trials, but also we need a forum to be able to present, discuss, and pick them apart. I think that's part of the process. Is if we have trials, none of them are perfect, but we can able to incorporate the main findings into our practice and all come to consensus on the strengths and limitations, it advances our field dramatically. Innovation is the heart of our clinical management right now, particularly on the minimally invasive side. When you walk around the theater hall like at Charing Cross, you can see how much has progressed and how many companies are trying to make products that can advance the delivery of care and outcomes for our patients. So innovation is critical from a device side, but also innovation is necessary on a clinical management side. How do we innovate virtual care? How do we innovate access to patients and clinical support? How do we innovate on clinical trials to be more pragmatic, but also to be further reaching? And so we really highlighted several aspects of where innovation can touch our patients, touch education, and touch research. And I think that's pervasive throughout what we do. Is we need to continue to push our resources forward to be able to not only be stuck on how we've done things in the past, but think about how we can progress in the future. Charing Cross has been a place that helped launch my career. One of my first international meetings as a clinician and researcher was Charing Cross, discussing the paclitaxel challenges. And I think this meeting is dear and near to me for that reason. But it's continued to return just a wonderful investment in terms of my education and engagement and networking. And I want to highlight that Charing Cross continues to excel in terms of offering the latest forward-thinking evidence, but also grounds for networking, for planning, and for collaboration. And I think this is a special meeting that really deserves a shout out. And I made a specific point of this in my lecture, in particular Roger and now Stephen Greenhalgh and the Greenhalgh family, about how we've all advanced because of sharing cross.